Hi, Courtney. How are you doing today? My name's Barry.
Hi,
I'm
Barry.
your nurse today.
Nice to meet you.
How are you doing today?
Good, thank you.
You just have a seat for me. Patient is alert and oriented. She's dressed appropriately for the weather and seems very happy, pleasant. Just going to check her skin. Perfused. Use the dorsal part of my hand. It's warm. She does have a couple freckles, but nothing out of the ordinary. No swelling, tenderness, and skin turgor is good. No dehydration. And we're going to move onto the head. I'm just going to check. No swelling. Head is symmetric. No dandruff. Good hygiene. Brown hair. Checks that. And I'm going to move down to the TMJ. If you could open and close your mouth for me. Good. TMJ intact. No abnormalities. And then into inspect. You can breathe for me. Good. Breathe for me. Nose is patent and clear. And no bloody, no erythema, a little bit of mucus. Alright, now I'm going to have you smile for me and stick out your tongue, wrinkle your face. Okay, good. Now close your eyes and just point to where I touch on your face. Keep your eyes closed.
Sorry.
Okay. Good. 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 Okay. Just checking some cranial nerves. They're all intact and good. And then I'm going to move your eyes, and I'm going to just blink for me. Good. Eyes are symmetric, clear. We're going to give her this chart real quick. Keep it about 14 inches away. You just read that bottom line for me.
EFRP.
Good. And then close your left eye. Good. Read this line for me.
NUGS.
Good. And then close your other eye. Just read this line.
RHSL.
Okay, good. Thank you. And then, so I'm going to check conjunctiva, sclera. Look up for me. Good. All clear. And then, okay, so I'm going to use my scope. In your eyes. Good. Good. Eyes are, oh, you have to do extra ocular movement. So just follow my finger, but don't move your head, okay?
Okay.
Mm-hmm. Good. Okay, and then look in the distance for me.
Okay.
I'm going to be bringing my finger together. Good. Good accommodation. And just look forward for me. Good. Keep looking forward for me. Good. Eyes are perla. Pupil is equal, round, reactive, accommodate to light. Ears. Okay, so I'm going to inspect your ears, and we're going to symmetric bilaterally. Good. No lesions, no swelling. Good. Hard, rigid. Good. I'm going to do the whisper test, so I'm just going to sit behind you. Just repeat what I say when you hear it.
A.
2.
2.
6.
6.
Good. I'm going to adjust your other ear. F.
F.
8.
8.
H.
H.
Good. Thank you. Appreciate it. And then I'm going to just check your lips out your tongue. I'm going to check your mouth. Good. I'm going to use the tongue blade. Good. And then one thing I forgot to check, we were just going to check if you could just try to open your jaw. Good. Just wanted to check your strength there for you. And then we're going to also check the gag reflex. I'm going to take my tongue blade, stick it in the back. Uvula rises. Good. And then just stick your tongue head back. Open your mouth for me. Check. Good. Checking the palates. Good. Thank you. Teeth are all there. Pink perfused mouth. No cavities, no abnormalities. Okay. And then we'll just One more thing, we're gonna make you say ah for me.
Ah.
Good. Oh, no, alright. Okay, you're gonna move on to your neck. So move your neck forward for me and backward, just like this. So we're just gonna go forward and backward.
Oh.
Checking your range of motion. Good. And then side to side for me. Good. And then turn like this each way. Good. And then we're gonna also do your strength. So I'm gonna put my hand here. I want you to turn to your left. Good. Now turn to your right. Good, thank you. So 5 out of 5 strength, full range of motion. Now I'm gonna palpate all your, okay, so we're gonna palpate all your lymph nodes. We'll just start here. Palpate, good. Back. I'm gonna use one finger for submental, submandibular, good. And while I'm here, I'm going to also palpate subclavicular, or supraclavicular, sorry. And then if you could lift your arm up. Here. Good. Medial, lateral, and anterior. Good, thank you. And then we can have you lay down. You want to lay flat for me? I did this a little out of order just because she was already sitting up, so take care of it nice and easy. So first we're going to inspect, and inspect the chest. Equal chest lines bilaterally, no abnormalities, skin smooth, no swelling, no lesions. And then, okay, yeah, the apical impulse, right there. So testing apical impulse. Present, no thrills, no abnormalities. Go listening to lung sounds. If you just take deep breaths for me. Deep breath. Good. Go in the Z pattern. Deep breath. Good. Deep breath. Deep breath. Good. I'm going to listen to. So second intercostal, the right hand side. Listen to carotid. Come on. Herbs point. Mitral. Tricuspid. No gallops, no murmurs. Alright. Posterior, so if you could sit up for me. Posterior. Maybe you could just face this way so they can see what's going back. Just have your legs dangle off. A little more comfortable for you. Okay, so inspect it. No abnormalities. Back is good. Isometric. We're going to be in the 9th or 10th vertebrae. You can just take a deep breath for me. Good. Good. Normal chest expansion. I'm going to listen. Deep breath for me. Deep breath. Deep breath. Good, thank you. Lungs clear bilaterally, no adventitious sounds. I'm going to have you lay down again. So we're going to look at the abdomen. It's flat, umbilicus is inverted, midline, no distension, no abnormalities. And we are going to listen to all 4 quadrants. We're going to start in the right lower and go clockwise. Listening for vowel sounds. Good. Normal active vowel sounds in all 4 quadrants. We're going to palpate lightly, starting in the same position, right lower quadrant. Watch your face for any pain, any grimace. Good. All right, no pain, no grimace. We started right lower, feet clockwise. Now we're gonna go a little deeper palpation. Good. Watch the patient face. Any pain with this? No pain. Good. And we're going to, we will actually, so we're gonna palpate the liver, spleen, and kidneys. So for the liver, going to lift up on the patient. Feel it right here. Take a deep breath for me. Feel the end of the liver. I'm going to do the same side of this. Deep breath for me. Good. Not felt, but that's normal in adults. Then we're going to use a duckbill for the kidneys on both sides. So deep breath for me. Good. Deep breath. Good. Then we're going to percuss the liver size just to get size forward. All right, and then mark the spot where we end. About 8 centimeters is normal. We're still going to percuss all 4 quadrants. This was just over there, so I did that first. Good, no abnormal sounds. This, good. Okay, so if we could, we're gonna do, actually we'll do, when you're laying down there, we'll do the JVD. So I can see her jugular vein pulsating, and we would lift up the bed about 45 degrees. So we lift up, then you go shine a light on, good, goes away, so no abnormalities. And then you can sit up for me. Okay. Okay, you want to sit and face this way for me? Off the end of the bed. Good. Just come tangle your heads. Just give me your hands. Okay. So no clubbing. And check your capillary refill. Good. Less than 1 second. Good. We'll check your pulses. Radial. Good. Radial. Good. 2 plus. Crowded. Good. 2 plus so far, both sides equal bilaterally. You want to lay down, and then roll. 2 plus, and lift this leg up for me. Check the popliteal. 2 plus, lift this leg up for me. 2 plus, and then lift both legs up. Check dorsalis pedis and posterior tibia. Good, 2 plus. And then we're going to do reflex. Since you're done now. Yeah. Yeah. Okay. That's it. Okay. This way. Can you just relax for me? No breweries. Check aortic. Good, no breweries present. All right, then you can sit up for me. Face this way. Can you just copy off of me? Good, a little faster. Good, thank you, stop. All right, then we're just gonna go. Good, a little faster. Good. All right. Okay. So if you could close your eyes and just point to where I'm going to touch you, okay?
Okay.
Good. All sensory in all quadrants, all limbs present. Do reflexes and then we'll do the form. So I'm going to do regular reflex. Support this. I'm going to hit my hand with the hammer. We're looking for expansion. I'm going to do triceps. Support form.